The reason that treating yeast overgrowth with an antifungal is often unsuccessful is because it doesn't address why the yeast are overgrowing in the first place. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, I want to tell you about a patient I saw a few years ago named Olivia. Olivia was a 39-year-old woman who came to see me for bloating and gas. She was very thin and she really did not look very healthy. And she also had some major concerns about yeast overgrowth. Now, I refer to it as yeast overgrowth, although some people would describe what Olivia had as a yeast infection. And during this episode, I'm going to explain why overgrowth is actually the more accurate term to describe what's going on. About a year before she came to see me, Olivia had developed symptoms of yeast overgrowth in her vagina. She was complaining of itching, a thick, creamy discharge, and burning when she urinated or had sex. If you've ever experienced this, you know exactly how uncomfortable the symptoms can be. Olivia's symptoms started after being treated with 6 weeks of antibiotics for a sinus infection. When she went to her OBGYN complaining about the vaginal symptoms, she was initially prescribed an oral medication called fluconazole, which works by stopping the growth of different types of fungal organisms and is sold under the brand name diflucan. What's the difference between yeast and fungus, you might be wondering? Are they the same thing? Not exactly. Yeast is a type of single-celled fungus, whereas fungus, or fungi, the plural, is a broader term that includes other organisms, including yeasts, but also molds and mushrooms, and those organisms can be multicellular. Olivia ended up taking 5 separate courses of fluconazole, each one lasting about 3 or 4 days, each course. And every time, her yeast overgrowth would respond and her discharge would clear up, but a few weeks later, the itching and burning and discharge would all come right back. And when we come back, I'm going to tell you exactly why that was happening. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. Olivia's experience is not atypical. The reason that treating yeast overgrowth with an antifungal alone is often unsuccessful is because it doesn't address why you have fungal overgrowth in the first place. We all have fungi in our body. They're present in low levels in the colon, where they help with digestion, on the skin, in the mouth, and in the vagina. And when I say they're present, I mean they are part of the normal, healthy ecosystem of your body. They are supposed to be there. It's when yeast like Candida and other fungi grow too rapidly that we have a problem. And this problem represents a form of dysbiosis, an imbalanced, disrupted microbiome. If you want to learn more about dysbiosis, check out episodes 26 and 27 of the Gut Bliss podcast. It's a 2-part series on causes and treatment of dysbiosis. Dysbiosis in the form of yeast overgrowth is especially common after taking antibiotics, because of the reduction in essential bacteria caused by the antibiotic that allows yeast to proliferate unchecked, because there's now more room in your microbiome because of all the bacteria that have been killed off. And the yeast overgrow and they colonize moist parts of your body, which is where they thrive in a moist environment. Yeast overgrowth can show up as a cheesy white vaginal discharge, thick white patches on the tongue or in your mouth called thrush, red areas under the breasts, between your toes, in your ears, or around your anus where it looks like diaper rash, dandruff on your scalp, pustules in your groin or armpits, or nail bed infections. Those are all manifestations of yeast overgrowth as a result of dysbiosis. When you kill off a lot of the normal, healthy, essential bacteria in your body, you create a void in your microbiome, and the yeast overgrow to fill that void. People often want to treat their yeast problem with an antifungal. They want to take a pill and get rid of it. But as I mentioned earlier, that does not address the underlying root cause of the problem, which is not really overgrowth of yeast. It's undergrowth, underrepresentation of essential bacterial species. Olivia was super frustrated with a lack of results from the fluconazole her OBGYN had prescribed. So she started doing online consultations with a functional medicine doctor who billed himself as a yeast specialist. He prescribed 8 more weeks of fluconazole. And this actually had me quite worried because in addition to the fact that Olivia had already taken 5 courses from her OBGYN and wasn't better, fluconazole has some pretty serious potential side effects, including liver injury in around 15 to 20% of people that can range from just mild liver enzyme elevation to acute liver failure and even death. Plus, there are less serious symptoms, and a lot of them are GI, like burping, heartburn, indigestion, and abdominal pain. When her symptoms still were not resolved after almost 3 months of fluconazole, Olivia's functional medicine doctor recommended an additional 8 weeks of therapy with an even stronger antifungal that had an even worse side effect profile than fluconazole. And this is when I felt like I needed to intervene. Since her symptoms began, Olivia had been on a strict diet with no grains whatsoever, no fruit, no starchy vegetables, and no sugar, honey, or sweeteners of any kind. She didn't really like vegetables, so she hadn't been eating many vegetables at all, starchy or non-starchy, and she had literally been eating primarily meat, chicken, and eggs for the last year. Yeasts multiply by budding. They split off in bulges from the parent cell wall, and this can happen rapidly within a couple of hours, especially when there's a lot of starchy, sugary food around. The sugars in these foods are fermented by yeast and converted to alcohol and carbon dioxide, which is why yeast has been used by humans for centuries for making products like bread and wine and beer. And it's also the rationale behind many anti-yeast diets that recommend cutting back or eliminating sugary, starchy foods. There is good science behind that recommendation. But the other thing that you need to keep in mind when you are trying to reduce a population of yeast is that you have to simultaneously increase your population of essential bacteria to fill that void. And what do essential bacteria, the really healthy kind like Faecalibacterium prausnitzii that you're trying to increase, what do they like to eat? High fiber foods. And these are primarily carbohydrates. They're complex carbohydrates. So if you're eliminating all carbohydrates like Olivia was doing, yes, you will probably reduce your population of yeast, but you're also going to reduce your population of healthy bacteria. And you're going to end up with a vicious cycle of suppression and overgrowth and continue to have an imbalanced microbiome as Olivia was experiencing. Coming up, what does work to get rid of yeast overgrowth? I suggested to Olivia that after all that antifungal medication, plus the super rigid diet she was following, there were probably very little yeast anywhere in her body, and that her bloating and gas were more likely the result of insufficient amounts of essential bacteria rather than yeast overgrowth. But Olivia was pretty steadfast in her belief that yeast were literally sort of taking over her body and needed to be aggressively treated. And it took multiple visits with me, plus a blood test that showed normal levels of antibodies to Candida to convince her otherwise. Getting Olivia to finally stop the fluconazole was not that hard. It was clearly not doing what it was supposed to do. But persuading her to liberalize her diet was very hard. She and her microbes desperately needed some real food and nutrients, particularly high fiber, complex carbohydrate foods that are so essential for cultivating a healthy microbiome. Eventually, over time, because she really just felt so sick, Olivia relented and she agreed to start adding in small amounts of foods like lentils and zucchini, and then some green beans, and finally some low glycemic fruits like Granny Smith apples and berries. The nutritionist who works with me persuaded her to eat quinoa a couple of times, but she was so afraid of anything that contained carbohydrates that she would only eat a few teaspoons. Over the next year, with the help of a lot of nutritional counseling, reassurance from me, some therapy, and a more diverse diet, Olivia gradually gained some of her weight back and started to feel a lot better. I want to leave you with 3 takeaways about yeast overgrowth. Number 1, yeast overgrowth is a real phenomenon, and it's one that conventional doctors are sometimes skeptical or poorly informed about. But yeast paranoia is also a real problem, and sometimes people have to be discouraged from adopting a too severe diet that isn't nourishing to their healthy microbes, or from over-treating for something that is not actually a problem anymore. Number 2, repopulating your microbiome with essential bacteria that can crowd out yeast and keep their growth in check is the hallmark of a successful treatment program. You can't just suppress yeast with antifungals and expect that you are going to return to a normal balanced state. And number 3, avoiding the factors that lead to yeast overgrowth in the first place is, of course, the best way to approach this. That means avoiding antibiotics and other microbiome disrupting drugs like acid blockers and steroids unless absolutely necessary, and eating a balanced high-fiber diet and not overdoing it with sugary, starchy food and alcohol. So that's it for this edition of the Gut Bliss podcast on yeast overgrowth and the importance of repopulation and not just suppression. Coming up next week on the Gut Bliss podcast, the NOVA classification for ultra-processed foods, what you need to know. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.